The Cook County Department of Public Health wanted to announce today that yesterday we had confirmation of our first Omicron case diagnosed in a resident in suburban Cook County. And in addition, there are several other individuals that are waiting genotyping to confirm or not whether they also have Omicron due to their exposure or travel history. But the surge of Delta is what's really of major concern right now, and it's peaking at this point. It's quite high. We are seeing over 1,000 new cases a day over the last several days of Delta. But as this goes further, Delta will begin eventually to diminish, and Omicron is almost certainly going to overtake Delta as the main variant circulating in the United States and then obviously in Illinois. We don't really know how long that will take. This is something that the CDC and others are working on to project, but based on what we are seeing in Africa and Europe in particular, it's likely to take over very quickly because it's much more contagious, meaning it's more easily spread even than the Delta variant, which is more easily spread than prior variants that were the most prominent, such as the Alpha variant. However, preliminary data, though it hasn't been completely confirmed yet, but preliminary data does indicate that Omicron is causes a milder form of COVID, which is good news, obviously, because that would decrease the number of deaths that we see and potentially decrease the number of hospitalizations as well. But one thing that we are certainly concerned about is hospitals and healthcare facilities being overwhelmed with positive Omicron cases, even beyond the Delta cases we see now, because people might still require some level of medical support, either in a clinic or a hospital setting. So the best way to combat that is to have both vaccinations, or the first one of Johnson & Johnson plus a booster once you are eligible for a booster, which means 6 months out after the second dose. Because the literature is now also beginning to come out showing that if you are vaccinated with 3 doses, basically, or 2 with the Johnson & Johnson, that can confer as much as 75% protection against getting severe COVID. So if you're not vaccinated, it means you're more likely to get a more severe case of COVID, even with the Omicron. So it's very important, and that's our main message, is to get vaccinated and to get your booster when you're eligible for it. And anybody above the age of 5, so 5 years old and older, actually are eligible for vaccines now and should get them as soon as possible. And if you're eligible for the booster, to do that right away. The other guidance that we are pushing out now is that as the holiday season is upon us, is that if you're not vaccinated, we recommend that you do not celebrate with others outside of your immediate household, that basically don't congregate in public spaces or even in private spaces with people that are not part of your own household. We are also recommending that everybody remain masked indoors, not only in public spaces, which is mandated by the state and by our own order of Cook County, but also even if it's in private homes, we highly suggest that you remain masked if you're with people that are not from your immediate household, and to make sure that you're all vaccinated if you do gather together. And also test yourself with these home test kits is just fine, or go to a pharmacy or a health facility and test yourself 3 days or so before the actual event, and then the morning of or the evening before the event, test again. So these rapid tests do work very well if you test at least more than one time in a row. And obviously don't go to these events if you test positive. So Dr. Joshi, anything else to add, or we can just have questions?
I think we can just move into questions. Thanks.
Okay. So Tom, if you could read the questions if you see them, it's
Yeah, absolutely.
jump off to see them. Thanks.
We've got a couple, and I think they're about relatively the same question. Can you reveal what municipality the person who was tested positive for the Omicron variant lives?
No, I'm sorry, we're not able to do that for privacy reasons, especially because this is the first case. It's not like we're saying there are 20 new cases in this municipality or 30 in another. So this is only one. So we're not going to reveal the location.
Alice Yen from the Tribune has several questions. I'll read them at once, all at once, and then we can take them one by one. Can you say the city? Can you say the city, age of the first Omicron case, and did they have 2 doses or 3 doses of the vaccine? We'll take that question first.
We know that they've had at least 2 doses of the vaccine, and we don't know yet the status of booster in this individual, but we're investigating that.
Okay. Are there other individuals whom you're genotyping, the people who have made contact with the first case? And if so, how many people is that? How many are you genotyping?
There are some, and there's a handful that we're genotyping. I can't reveal the number.
And I think her question also involves, are they contacts or close contacts of the first case that we're talking about?
We are investigating positive cases that are also contacts of this case, as well as a couple of other individuals that do not seem to have a direct contact, but these investigations are underway right now. So we don't have all those details even in our department yet.
Absolutely. And her final question is this Illinois' second Omicron case?
I think it's the second confirmed case. I don't know how many confirmed cases the city of Chicago has reported. I do know that throughout the state, there are a variety of suspected cases that are in the process of being verified.
Excellent. Kristen Schorsch of WBEZ. Wishes you a good morning, first of all. And
Thank you.
Can you tell us more about how the person who has been diagnosed with Omicron potentially got it?
It was through a contact with somebody else that had Omicron.
Also, she asked, are the other people who are being tested for Omicron tied in some way to the original person diagnosed with having the variant?
Most of those that we are investigating are, and there are a couple that there are not, but like I said, we're still investigating. So there may be a connection that we have not determined yet.
Kristen Thomas, WTTW asks, do you know when the individual received their last dose of the vaccine? How many days or months removed from the vaccine are they?
Several months, and I can't tell you how long at this point.
Okay. Jonah Meadows asks, who determines which samples are tested? I lost this question. Who determines which samples are tested to determine if it's Omicron and on what basis?
All right, it's done in 2 different ways. As you know, the state of Illinois, in their labs, as well as certain other labs that have received specific funding to do this, especially in the city of Chicago, several institutions have been genotyping to find out what variant anybody is infected with over the last few months. And right now, the state is requiring all labs that do the analysis, that do the PCR tests, to send a certain percentage of their specimens to the state lab or to one of these other labs that are cooperating in this program for genotyping, so that we get a certain sense of how widespread a particular variant is. So in general, that kind of genotyping has been going on for several months, and probably even beyond by the state, but other labs have now, other genotyping setups have been brought up in other lab areas, especially in certain hospitals. But for Omicron, if we have a specific suspicion of Omicron based on a travel history or contact tracing and finding that they are potentially exposed to someone with Omicron, then we will make a specific point of asking the lab that had done the PCR to send that specimen on, in addition to the 10 or 20% of the specimens that they send on anyway in a random fashion. So if we're concerned about Omicron, we contact the lab who had done the PCR and ask them to do genotyping if they do it themselves, and if not, to send it to the state lab, and we facilitate that.
Excellent. Jonah has another question. How many samples have been genotyped for the variant so far in CCDPH's coverage area?
I don't know if we can trust that the labs are sending in the percentage of specimens that they're supposed to. I think that's between 10 and 20%.
Mitchell Armentrout asks, how long do you think it will take before Omicron is the dominant strain?
Time will tell. It's overtaken in the UK in just a matter of weeks. I imagine that we will begin to see the same. As many of you may be aware, Cornell University had several hundred cases of predominantly Omicron amongst their student population, and they basically have closed down the university and gone virtual, and hopefully are taking care of their students. Nobody has gotten severely ill. So this is something that's spread very widely, admittedly in a fairly enclosed situation. You know, it's on a university campus where people live in dorms, etc. But that only illustrates how very quickly it can spread, even among a vaccinated population.
Great. Alice Yen of the Tribune has another question. She says, so the first Suburban case made contact with someone who also tested positive for Omicron. Where is that contact from? Chicago, out of state?
I can't say.
Okay. We have a question. Can you describe the symptoms of the person who was tested positive? Are they mild or severe?
Actually asymptomatic. They were
Okay.
tested because they were close contact and came out positive.
Okay. Alice has another question. What demographics are you most concerned about with Delta? And if it's children, are you concerned about in-person learning?
I mean, for the demographics for Delta, there's different concerns. One concern is for those people that are not yet vaccinated or had that 2-week period after a vaccine, which mainly are our children, especially those under 5, where we most recently have brought them, that there's been authorization, and those under 12 as well. So of course I'm most concerned about the spread, but I'm most concerned about Delta, whether as breakthrough cases or even as original cases amongst people that have underlying medical conditions, immunocompromised or older, above the age of 65, who get Delta, especially if they're not vaccinated, because they are the ones that are going to have the most likelihood of having severe complications with COVID. Smaller children likely get asymptomatic or milder disease in general, but occasionally children do get hospitalized. We are very concerned, on the other hand, about schools, even though I'm not as concerned about school children on an individual basis of getting severe disease. I'm worried about them bringing it home and infecting a grandparent that may or may not be vaccinated. But I'm concerned about schools is because across the country, we're seeing outbreaks in schools of all age groups. And sure, I'm concerned about there being in-person learning, but I think in-person learning can be done safely if the safeguards are put in place. And some schools have allowed hybrid learning, especially for a child that might be a close contact that has to be kept out of school for a period of days while they are in quarantine. However, you know, we also have to understand for teachers, it's extremely difficult, and many of them are doing this incredibly well, is having to have a hybrid classroom where they are teaching in person to a group of students, and at the same time have to make sure that their face is on the computer so that they can be teaching those that are remotely connected. So I think we really want to have children in school for a variety of mental health as well as educational reasons, obviously. And I think it can be done safely if masks are absolutely enforced and that they have strict protocols for testing. I think everybody needs to be tested in schools. Right now, there's an opt-in option in many schools that are doing testing. I think I would recommend required testing. and vaccinate any child who's eligible to be vaccinated. And then I think we can maintain in-person schooling.
Excellent. Thank you. Thank you, Dr. Rubin. I don't see any questions in the chat. We'll wait in case someone is typing one, perhaps. So we'll wait a few minutes. Dr. Rubin, just let me ask you what, I know you've gone through this, but what would you like our reporter friends to tell the public in terms of what steps they should take in terms of holiday gatherings and so forth? What remediation steps should be followed?
Yes, the main
Remediation.
take-home messages are the things that we've been saying all along, as well as a couple of additional things. So the things that we've been saying all along are, please abide by the indoor masking requirement, which means everybody, vaccinated or not, in public indoor spaces should be masked. We are also recommending for holiday gatherings, even if it's in a private home, if you are with groups of people who are not part of your household, is to make sure that you are vaccinated or stay home. If you are vaccinated, especially if you've had boosters, I would suggest that there be rules for the gathering, that everybody has to be vaccinated and everybody boosted if they are eligible for that booster at that point, and that you wear your masks indoors as much as possible, even if you've been vaccinated. And also obviously wash your hands frequently. Maintain physical distancing by 6 feet if at all possible. And the final thing is, that's a little bit newer of a message, is that it's recommended that you get tested. And now all testing is covered by insurance. So even if you buy a test kit online, or if you go to a pharmacy or a healthcare facility to get tested, that can be submitted to insurance, and it's supposed to be covered by insurance. The US government is also working to make sure that public insurance plans will also be covering this testing. If you go into a pharmacy, PCRs are free. The problem is that these test kits you have to pay for, and they are not necessarily cheap, inexpensive. But nonetheless, test about 3 days before the event, and test the morning of or the evening before you go to that event. And if either of those tests are positive, obviously stay home and consider yourself positive, and then go get this test confirmed by a PCR.
Thank you, Dr. Rubin. I don't see any other questions in the chat, so we will end here. I will make this recording available to everybody. I'll send it back out. We thank you for your time this morning. Thank you, Dr. Rubin. We appreciate your time as always, and I hope everyone has a good day. So thank you, everybody, and I'll be available all day if you have questions.